Hello again, it's Dr. Jarrod Bagley. This week's topic of focus is on hip pain. We've got a lot of patients that come in and that's their chief complaint area, but sometimes it's confused as to whether or not it's truly hip pain or it has to do with the SI joint. The hip being here in this little socket where the femur connects to the pelvis, and the sacroiliac joint is a joint between the ilium of the pelvis and the tailbone of the sacrum of the pelvis. And so what we're trying to do in this case is determine what is the true nature, the true cause of these symptoms. And most commonly, the cause of these symptoms is due to mechanical problems. Now, mechanical can be subluxation. Mechanical can be abnormal footwear or shoe wear. So if you wear high heels often, or flip-flops in many cases. We're in the summer months here in Austin, Texas, and that's typically standard attire, but unfortunately it is not the best footwear for your health and for your spine. Ultimately, these mechanical problems, if continued and repetitive, it continues to cause more damage, and this can cause both soft tissue damage as well as arthritic damages within that particular joint. So it's best to correct these things as early as possible, as soon as you start to notice these things. First of all, to kind of describe some of these mechanisms, obviously, the shoe wear is self-explanatory. It's it's finding appropriate shoes that support your arch, that allows for proper gait patterns and biomechanics within your walking and running biomechanics. But then also there are things like we talked about, subluxation, and many people may not know exactly what that is. Subluxation occurs in the joint, and ultimately it's when a joint is jarred out of place. And when those joints are jarred out of place, it causes soft tissue damage around the joint, which inflames and creates irritating stress on these little nerves that exit from in this case, the lumbar spine or the low back. These are the nerves that supply both the sacroiliac joint and the musculature surrounding and stabilizing that joint, as well as the hip joint. So if we have irritation to these nerves, it creates improper signals and causes muscle imbalances, which will allow for those biomechanics, and over time can create both soft tissue damage as well as hard tissue or arthritic damage. So this is one of the things that we address initially to restore proper biomechanics within the lumbar spine so that we get that proper nerve feedback, not only for proper mechanics, but also healing of any damaged tissue. This is how your body heals that tissue as well. Now, the other things that we would look at are foam rolling techniques to reduce muscle tension. We'd look again at footwear, determine if there's any orthotics that need to be addressed within the shoe, and then also give some lifestyle modifications to some of the activities that could be contributing to this as well. Well, I hope this has helped you. If you're struggling with hip pain and you have more questions, please reach out to us. You can send us an email at info@correctivechiropractic.net. I'd be happy to respond to that. Please share this with your friends that do have hip pain, and just remember that I love you, and thank you so much for helping me to be the doctor that makes people stronger.